All right, hey everyone, it's Drew again at the IM3 booth at ASAPS 2017. I am joined by Dr. Patel. Welcome.
Thank you, Drew, very much.
Cool. How's the show going so far?
It's going fantastic. I love coming to the show all the time. I learn a lot of new things. I pick up on the latest advancements, and I just like to stay informed and up to date so I can bring everything back to Jersey. It's great.
Great. What are some of your favorite sessions? Some stuff you're looking forward to bringing back?
So this year was the year of the butt.
Okay.
So
I've heard that from a lot of people.
Last year was the year of feminine rejuvenation and labiaplasties and non-invasives, and this year is kind of transitioned into the year of the butt and fat grafting and also non-invasive. So it's kind of been a big year for that.
Okay, cool. Tell me a little bit more about your practice. Are you doing a lot of the BBL stuff?
Sure. So I've been doing some BBL stuff, and it's become a lot more hot over the last several years. And so, as with everything, as things get more popular, you start doing a lot more of them.
Yeah, absolutely. It's amazing over the last 2 years, last year, how the Brazilian butt lifts have just gone like this, and then
it's crazy with the advent of all these other people online and in Snapchat and all these things talking about butt lifts, and it all began with J-Lo, but
exactly,
it's progressed a lot further from there.
Why don't you give us a quick how do you do a Brazilian butt lift for your patients that'll see this, because it's pretty non-invasive, right?
Yeah, it's a minimally invasive, I would call it, and minimally to moderate, depending on how you look at it. So the huge bonus of a Brazilian butt lift is that I do it with fat grafting.
Okay.
I don't think it's as great to do it with the implants. I think it's a lot safer and a lot easier to do it with fat grafting. And so the big bonus is that you get to do liposuction in all these fun places. So you get to minimize that waist and then build up that butt. And really the ratio between those two things is where that Brazilian butt lift really comes in.
Okay.
Sometimes you'll need a little bit of fat to make that butt stick out and make it, give it that nice round, appealing shape.
Right.
Otherwise, you need to do a whole lot. It just varies. So
you're actually using liposuction to remove fat to make you look thinner in certain places, and then taking that fat and injecting it in your butt to make your butt look more shapely and round.
Absolutely right. And everybody has a different shape that they like. Some girls like that round, short, nice sticking out butt. Some girls like that tall, rounded, full butt. So there's a lot of variation in different people. And when we take the fat out from the belly, from the flanks, from the sides, and everywhere else, we kind of clean it up, and then we stick it back in, and after a few months, it's yours.
Cool.
It's permanent. What
do you recommend for your patients, a prospective patient that wants a Brazilian butt lift that comes in? Do you recommend they come in with like a photo of like, hey, this is the shape I want to go with, or?
Yeah, that usually helps, because like I told you before, there's a lot of variations in what people want.
Right.
Their body shapes are different, and then they're asking for different shapes. Some people can have different shapes, and some people really can't, so it really helps me get a good understanding of what they want if they bring in pictures. And then, of course, sometimes we have to have that conversation because it may not really be possible what they're asking for. So
what's the picture you get the most, the Kardashian or J-Lo?
So actually, the trend has been getting a little bit smaller. It
really?
used to be the really, really, really big butts, but I think with more people wanting bigger butts, there become more people coming in with more realistic expectations. Because if you get that really skinny mini girl like a Kylie Jenner or somebody else who has that tiny, tiny waist and not a whole lot of fat, you're really not going to get a whole lot of fat to put into her butt. So they got to have a little more realistic expectations.
Cool. That makes sense. Awesome. How long have you been a member of ASAPS for?
So this is actually my first year being a member of ASAPS.
Awesome.
I've come to the meetings for the last 9 or 10 years.
Awesome. Cool. Well, this is for the patients that are watching this. This is one of the most prestigious plastic surgery associations in the world, because you have to be board certified plastic surgeon to be here, and the people that are part of this community are just truly fabulous.
Absolutely. We're at the top of the field, and we pay attention to safety, security, and we try to guarantee as much as we can when we're trying to get results for people.
Well, congratulations on being a member, because I know that's a big deal for
much.
This industry. I still got some more for you. So let's do some rapid fire, just fun, quick questions. Learn a little more about you. What's your favorite color?
Blue. Carolina blue.
There you go. Are you a North Carolina fan?
I am a Chapel Hill graduate.
Oh, sweet. Awesome. So I was going to ask you, what's your favorite sport?
Basketball.
Is your favorite sports team the Tar Heels?
Absolutely. You
Nice.
got it.
You have any children?
I do not have any children yet. Maybe that's going to change in the near future. We'll
awesome.
see.
Congrats. Congrats on that if they come. What was the last thing you watched on TV?
Big Bang Theory.
Nice. Great. Hilarious show.
It is. It really is.
Any advice you would give to a previous boss?
To a previous?
Boss. Any advice you would give to a previous boss?
What do you mean by boss?
Like did you ever have a boss before? Yeah.
I've been my own boss my entire life,
yeah.
except in residency.
What about maybe a previous mentor?
Right. So I would say make sure you're human and you relate to everybody and anybody. When I'm walking around the hospital and I'm, let's say, the boss of the operating room or my procedure, I try to make sure I get to know from the janitor all the way up to my scrub nurse, because every single one of those people plays a significant role in our lives. So nobody's unimportant. You have to, at some point, somebody can be very important to you. So don't neglect anybody.
I love that. That's great advice right there for any leader in any industry.
Absolutely.
Cool. Why'd you get into plastic surgery?
So it's a great story. I actually got into it not even knowing what the heck plastic surgery was. And one day in my rotations, I kind of got the short stick, and I had to go do a plastic surgery rotation.
Okay.
And the most amazing, I went and saw the most amazing things on the very first day. And the second day, it was just a repeat. It just blew my mind, the different things that you can do with plastic surgery. There's a level of artistry and innovation that not a lot of fields in medicine still have. It's one of the few where we can still go around and, use our creative abilities in this field.
You guys
are
artists.
Yeah. It's
100%.
a lot of fun. It's great.
Yeah.
It
Cool.
keeps our brains very occupied. I love it.
Oh, I'm sure. I always talk to people about, like, being a plastic surgeon is one of the hardest things in the world, not only to be a plastic surgeon, but then you have to have a business as well. Like, the amount of mental capacity that you people have, it's truly admirable. It's like,
yeah, you're kind of running on all gears a lot of times.
Yeah. I mean, you guys are like superhumans. What were you like in high school?
I was a big dork in high school.
Okay.
Absolutely.
What kind of dork? Like
dork
Star
ever.
Wars collection dork?
I love Star Wars. I guess sort of like a geeky dork. I don't know, whatever you would call it. But, I like to read a lot.
Yep.
I did a whole lot of science fiction, and I think that plays into the whole idea of artistry and desiring, change and wanting to see what's next, what else can you do with the things that we do. I think that led a lot of my passion for, learning new things.
Awesome. Okay, last question. If you could be any kind of animal, what animal would you be?
Oh, wow. I'd probably say I'd be a lion.
Yeah? Why so?
Yeah. I think they're beautiful creatures. They've got this gold mane, and if anybody's seen a picture of me, I don't have any hair.
Neither do I.
There you go. But I think that mane is just beautiful. It's gorgeous. It frames out their faces, and they're just gracious creatures.
So you want to be a lion because you're envious of their hair?
Yeah, sure, okay. I actually think
kidding.
their color is really beautiful.
I'm
It's
just
like
kidding.
nice and bright,
Yeah.
but it's got that warmth associated to it too.
Yeah.
So I really like the
And
color
they're
of
strong,
lions.
they're leaders, they're
Correct.
courageous.
Yeah, absolutely. But it's like they just represent a great character, I think.
Absolutely.
Yeah.
Cool. Well, thanks for having us, Doctor.
All right.
Have
Nice
a good
to
rest
meet
of your show.
Thank you very much.
Take care.